again, and we will continue discussions the last lecture, which is about the cystic fibrosis. Cystic fibrosis that is causes by mutation in the CFTR, which is the first name of the cystic fibrosis, and TR gene, which is composed of 27 axons. It's the most common autosomal recessive disease genetic disorder. When I said autosomal, that is mean it's not related. If it's female or male, that's no connection about these things, okay? And it's recessive genetic disorder. CF is so rare in Japan. Clinical manifestations are there is this effect in the lungs, so it causes pulmonary disease in the child. When it's just like a baby, it causes meconium ileus and causes pancreatic insufficiency and increasing the chloride concentration in the sweat. The mild form of the cystic fibrosis characterized by congenital absence of the vas deferens. Okay, so the mild form that is lead to the congenital absence of the vas deferens, which is present in the male, and the main problems is pulmonary exacerbation and bacterial infection. We can say it's a complication of this disease that is causes pulmonary exacerbation and the bacterial infection. Most common cause is respiratory failure of the death, despite Germany do newborn screening for 1 year, but at 1 year it will be irreversible lung damage, so it will be good if that is happen after the 1 year. Early diagnosis results in the early therapy and improving the lifespan. We have another disease called severe combined immunodeficiency, which is S severe, C combined, I immune in D deficiency. Complete lack of immune defense, high rate of infections, will die within 1 to the 2 years of the life. Severely underlying genetic defects characterized by the T cell deficiency or lack of the T and P cells deficiency. Within the screening, there is no mutations in the screening. We don't look for the mutation in the DNA. We just make PCR to measure the TREC, which is known as the T cell receptor excitation circles. But the question is, what is the TR? As you can see, we didn't look for the mutation in the DNA. We actually look for this TREC, which is known as a T cell receptor excitation circles. They are just a small DNA fragment that are created waste product when the TCL is made, because their number indicated how many new naive T cells has been formed. To check if the PCR worked correctly, they are beta actin. They use the beta actin as a control. And then we go to the spinal muscular atrophy, autosomal recessive disease linked to the chromosome 5q, affects 1 to the 10,000 newborns in Germany, characterized by the progressive motor neurodegeneration leading to the muscular atrophy and weakens without therapy, death mostly within 1 to the 2 years of the age. So the test can be done in a dried blood samples. SMN1 SMN2 gene copy is associated with the severity of the disease. What is used or what is under evaluation in the Germany as a potential newborn screening target? FQ linked SMA after antisense oligonucleotide drug therapy. And then we talk about the sickle cell disease interaction between two deoxygenated hemoglobin S molecules, phenylalanine 85, valine 88, and valine 6. Glutamic acid 6 in the beta gene is replaced by the valine. Approximately 1 to the 100 West Africans suffer from sickle cell anemia. Disease follows autosomal trait of the interference. Why is that frequent? Sickle cell anemia provides protection against the malaria, and people with one sickle cell disease carrier are more likely to survive malaria. So hemoglobin A, hemoglobin S interact, and that is lead to the 5-strand formation amine and that is lead to the alignment and the crystallization fiber formation. The fiber distort erythrocytes so they clog small capillaries and impair blood flow. So the results is that is lead to the blocked blood flow, pain, organ damage, anemia, and increase of the infection. Potential life-threatening disease, shortened life of erythrocyte, recurrent microinfarction, pain and life-threatening organ dysfunctions in a newborn that is lead to asleepnia, bacterial infection, and anemia. Newborn screening is useful when the disease is not already obvious because of a clinical symptom in a newborn period. Disease is treatable and irreversible damage to the brain can be avoided by the early treatment. A disease is not rare and represents significant health problems for the person or community, suitable and accepted that allow early detection, that an appropriate cost benefit ratio. Marker VERT, which is called marker value, specific measurement or indicator used to evaluate a particular condition, used to diagnose, monitoring, or studying health condition biological process, and the implication of the false negative and false positive test. We have to know two things. The prevalence is the proportion of the population found to have a condition at a particular time point or a specified period of the time. New or existing cases or incidents, proportion or rate of the person who develop a condition that's been newly diagnosed during a particular time period. And this way we finish the last lectures of a clinical chemistry. Thank you so much for listening. Hope you understand and anything, and I will provide in the community the whole PDF.